Have you ever looked in the mirror after an aesthetic procedure and thought, something's just not right? Or maybe you're still doing your research before making a decision? If so, this video is for you. Because in medical aesthetics, even small mistakes can lead to unnatural results, facial imbalance, or even permanent damage. Today, I'll walk you through 5 of the most common and often overlooked clinical mistakes in aesthetics. Every point is backed by respected textbooks and expert-level protocols. Whether you're a practitioner or a patient, this will give you a perspective you won't hear everywhere else. Let's start with number 1. Botox isn't just a wrinkle eraser, it's a neuromuscular modulator. Without proper muscle analysis, things go wrong. Carruthers and Carruthers emphasize this in their textbook, especially in the forehead, glabella, and around the eyes. Even a small misjudgment can completely change a person's expression. I had a patient once, standard dose Botox forehead, but her brows drooped, her face looked blank. We adjusted the injection points and suddenly her expression came back to life. Here's why this happens. Every face has different muscle strength, tone, and symmetry. Without a proper map, injecting blindly is like driving at night with no headlights. Number 2. Filler injected into the wrong layer. A common mistake, especially under the eyes. Braz, in his anatomical guide, says clearly, every part of the face has its own safe depth. Injecting without that knowledge, that's how you get the dreaded Tyndall effect, puffiness, or lumps. I once saw a patient with persistent puffiness 3 months after filler. Turns out it was placed too superficially. We had to dissolve and reapply, this time in the correct plane. The difference? Night and day. Number 3. Adding volume without understanding the face as a 3D structure. Have you ever seen a face that's full but still looks tired? That's what happens when we treat lines but ignore structural support. De Mayo's MD codes teach us to restore anchor points. If you only treat the folds without support, you add weight, but the face still droops. Here's the truth. Facial beauty is about lift, not just volume. Strategic points like the cheekbones, jawline, and temples anchor the face, ignore them. And even the best filler won't work as intended. Mistake 4. Thread lifting without analyzing the face type. It's not magic. Wan Lee says it clearly. Patient selection is everything. Thick skin, heavy fat, weak ligaments, threads won't work here. I had a client who said it didn't work, but the truth was, her skin type was never evaluated. We needed structure first, like filler support, before threads could hold. Number 5. Mesotherapy and PRP. With no protocol, just mixing cocktails, hyaluronic acid, vitamin C, DMAE, and praying for results, that's not science. Philippe Petit says, tailor it to skin type, age, even season. Otherwise, it's just a guessing game. I remember a patient with sensitive skin. After a random rejuvenation cocktail, she had swelling, redness, 2 weeks of discomfort. With a tailored protocol, we could have prevented all of it. So, what's the takeaway? Medical aesthetics is not just about injecting. It's about judgment, responsibility, and long-term results. If you're a patient, ask questions. If you're a practitioner, learn to avoid these mistakes. On this channel, I'm not just showing before and afters. I'm building a space for clinical thinking, aesthetic strategy, and evidence-based education. Starting with this video, we're launching a full educational series in medical aesthetics. Hit subscribe and turn on notifications so you never miss a lesson